Just ahead of New Year's Eve, the new JN.1 COVID-19 strain has raised alarms. India has reported 702 new COVID-19 cases and 6 deaths in the last 24 hours. The recent surge in COVID-19 cases continue, with India's active caseload standing at 4,097. Delhi has also reported its first case of the COVID-19 subvariant JN.1. A total of 109 cases of JN.1 has been reported in India so far. The resurgence of cases is being closely monitored, with rising concerns over the JN.1 variant. While one must remain mindful over the emergence of the JN.1 COVID variant in India, experts have urged people not to panic, stating that this variant is a mild disease with minimal symptoms. No evidence suggests that JN.1 causes more severe illness than previous strains.
But mostly it is a mild disease because out of that 56,000, only 350 required hospitalization, only 9 in the ICU. 99.9% or 99.5% will be undetected or very minimal symptoms. Only 0.5% will be requiring some assistance.
Despite its high transmissibility, the symptoms are generally mild. There have been no reports of increased hospitalization due to this variant, and officials have reminded that there is no need to panic or to be worried despite the rising number of COVID-19 infection cases. Now, symptoms associated with JN.1 are similar to those of other variant. This includes fever, runny nose, sore throat, headache, and mild gastrointestinal issues.
What the data suggests is that it is more transmissible,
it is spreading more rapidly, and it is gradually becoming a dominant variant as far as COVID-19 is concerned, both in US, in Europe, Singapore, and we are seeing more cases in India also. So it is causing more infection, possibly because it is more transmissible and taking over the older strains. But the data also suggests that it is not causing more severe infection, not causing more hospitalization, and most of the symptoms are predominantly of the upper airways like fever, cough, cold, sore throat, running nose, and body aches.
Now there's ongoing research on vaccine effectiveness against JN.1. As per reports, booster doses could enhance protection with a better immune response. Updated COVID-19 vaccines are expected to increase protection against JN.1 as they do for other variants. Wear a mask, avoid crowds and gatherings especially during this season, sustain a healthy lifestyle to boost immunity. Now, considering the upcoming festive season, Union Health Secretary said states should put in place requisite public health measures and other arrangements to minimize the risk of transmission of the disease. Earlier, the AIIMS Delhi director in a meeting discussed policies on COVID-19 testing, the areas to be designated for positive patients, and their hospitalization with all heads of departments of the hospital.